Sorry if you couldn't hear what I just said, but I wanted to give you an idea of what life is like for the 360 million people who live with disabling hearing loss. What I said was that inability to hear completely changes an individual's ability to interact with the world. In fact, Helen Keller, who is notably both blind and deaf, said, "Blindness takes away our ability to interact with things, but deafness takes away our ability to interact with people." 80% of people who live with disabling hearing loss live in low and middle income countries, in areas where access to healthcare providers is particularly limited. In fact, in Kenya specifically, there's only one ENT per 1 million people. Many kids with hearing loss end up dropping out of school, not because they're not intellectually capable, but because of the inability to identify that hearing loss was the reason that they were falling behind. Our team, led by the CARES Foundation, and Dr. James Netterville, former president of the American Academy of Otolaryngology, has been in Kenya teaching local ENT, ear, nose, throat residents how to conduct complex head and neck surgeries over the course of the past 20 years. Throughout our time there, we've noticed that several kids present to our clinics that have the inability to hear, but they lacked basic screening and treatment options. Understanding the enormous impact that hearing can have on an individual, we work with the local population to create a sustainable, cost-effective hearing screening program that utilizes local resources and infrastructure. Despite lacking access to basic healthcare providers, 81% of Kenyans have access to a mobile phone, and 88% of Kenyans have access to the internet. To put that in perspective, that's more Kenyans that have access to clean water. With this in mind, we created a program that utilizes mobile technology to help us capture pertinent information in screening and treating these patients. Prior research has validated the concept that an image taken of the middle ear with a cell phone is the equivalent to an otolaryngologist's microscopic examination when it comes to diagnosing disease processes of the middle ear. Furthermore, other research has shown that mobile phones can capture clinically validated audiograms or hearing tests that can diagnose and quantify an individual's ability to hear. To date, no one has combined these two technologies in the place that they arguably are needed the most, in the developing world, where patients simply don't have access to healthcare professionals that can treat their hearing loss. Our program is designed to be carried out by local community health workers who can go into the community with a single mobile phone and collect audiograms and photographic images of the middle ear, allowing a local otolaryngologist to view a patient's electronic chart and make basic medical recommendations. For patients that local practitioners need further advice on, they can simply share these images online with experts anywhere in the world. Patients without access to an ENT but have access to a community health worker who has a mobile phone now have access to healthcare. Kids with ear infections can get eardrops. Kids that have a hole in their eardrum have access to surgical treatment. And kids that have mild hearing loss can at least get to sit in the front of their class to prevent them from falling behind unnecessarily. With objective evidence of these patients' hearing outcomes based off of our mobile audiograms, pre- and post-intervention, we can easily measure the functional outcomes of our intervention. Ultimately, it's programs like this that will decrease the disability-adjusted life years, or DALYs, in places like Kenya. We've received grant funding from the Vanderbilt University Medical Center and the American Academy of Otolaryngology, and a financial backing from the CARES Foundation and the Kenyan government. Various aspects of this program have been presented at top academic conferences throughout the world. We've also trialed our program in Haiti and have plans to scale up and screen every child K through first grade in the country. And it's our hope that other groups can use our program and conduct similar screenings in other countries that have low access to ENT providers but have high prevalence of hearing loss. Our program was dreamed up a little over a year ago, and therefore we're still in the early implementation and development stage. Additional funding will help us scale up our project and further our software development. We're also seeking partnership with groups that have access to hearing loss treatments, including hearing aids. Thank you for the opportunity to participate in the Social Impact Pitch. We look forward to the opportunity to share further details of our project with you in New Haven. Thank you.